This is the project about management of animal diseases and antimicrobial use of information and communication technology to control antimicrobial resistance in East Africa. The objective of the project is to provide an information and communication technology framework for improved monitoring and control of antimicrobial use and antimicrobial resistance in livestock in low and middle income countries. The principal investigator for this study is Dr. Lawrence Mugisha.
Okay, good morning. I'm Dr. Lawrence Mugisha, Associate Professor at Makerere University College of Veterinary Medicine, Animal Resources and Biosecurity. I'm a veterinarian. I've practiced veterinarian both in domestic and wildlife animals, and I've worked mainly at the interface of animals, wildlife, humans and environment, and my major focus is looking at those diseases that affect both humans, animals and environment, especially zoonotic diseases and other infectious diseases. However, beyond that, we've been working on a global challenge currently facing the whole world, and this is the challenge of antimicrobial resistance. Antimicrobial resistance emerged, has been with us for some time, but currently it is called a silent pandemic because it has spread widely. It has affected a large group of people. So many people are affected, and also animals are affected. And the biggest currently, it is estimated that about 700 people are dying every day because of antimicrobial resistance. And it is estimated that if nothing is done, in the next 10 years, 10 million people will be dying of antimicrobial resistance. Currently, actually, it is estimated that antimicrobial resistance is killing more people compared to HIV and cancer combined. So that is a very, very huge problem. So as part of my research for the last 5 years, I've been working with different research consortium, working on the challenge and the problem of antimicrobial resistance. One of our projects was looking at the drivers of antimicrobial resistance in animals, humans, and the environment. And this project was being done here in Uganda and Malawi. And then another project is trying to develop an information technology system for monitoring the diseases. Especially we are starting with poultry, developing different technologies, including mobile apps and websites. So that is a huge problem, and because of limited knowledge and limited understanding of how antimicrobial resistance is taking place, it is not a disease that you can say I'm suffering from this disease, and because of that there is limited attention, but also there is limited data. So our role is to collect data, improve more research, carry out more research, and take surveillance at different levels, and especially there is limited studies going on in animals, especially livestock. But also, as we do that, we don't want to wait. We want to make sure we advocate and we carry out what we call antimicrobial stewardship. Limited work on antimicrobial stewardship is going on in humans, but limited to none when it comes to management of livestock. And remember, one of the drivers of antimicrobial resistance is misuse of antimicrobials, especially antibiotics. In human medicine practice, you can go to a pharmacy or a drug shop in any of this country and ask for an antibiotic, and they will not ask you that where is a prescription. They will simply give you an antibiotic you have requested. They will even ask you how many tablets do you need, so they give you according to your what? To your pocket. Now, there is a malpractice at the drug shops and at the pharmacy. Then there is a malpractice at the user, the individual who has taken antibiotics. Some of them, they will get antibiotics, reach home, take only once or twice, they feel better, they stop taking antibiotics. That means we are exposing small quantities of antibiotics or antimicrobials to these pathogens or organisms causing the disease, and eventually they get used, if I use a layman's language, they get used to these small quantities of the antibiotics, and that in scientifically and technically, that's what we call antimicrobial resistance. Once you get infected by resistant pathogens, they will not be responding to the routine antibiotics that you've been buying in the pharmacies or in the drug shops. That means people are going to fall sick for a very long period. They are going to spend a lot of money on antibiotics that they are not working, and eventually some of them end up dying. So that is a very, 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 very huge problem. Treating cases of antimicrobial resistance is very expensive. So we just need to prevent that. But also we are putting in danger about our breeds. Most of these antibiotics, which are important to our health, to animal health, once the pathogens become resistant to them, then they are rendered useless. And then getting new ones on the market is not easy. It is a very big what? It is a very, very big challenge. So that's why for us, we are focusing on looking at microbial resistance drivers, both at the humans, animals, and environment, using a One Health approach. And actually, One Health approach has been agreed internationally and globally that it is an approach that is desired and needed if we are going to address the problem of antimicrobial resistance. Now, other diseases, sometimes they say it is only experts who are responsible. This antimicrobial resistance requires everyone to be responsible. Even we need to teach our children to become what? Responsible. When we buy medicine for them to take as prescribed by a medical doctor, they should adhere to that regime of taking those antibiotics, but also avoid self-medication as part of reducing the burden of antimicrobial resistance. I'm so passionate about this topic that when I continue to speak, I may not end. But for the purpose of this message, I like to call upon the public that let us, all of us, be vigilant, be responsible in the use of antimicrobials, help our neighbors, help our friends to understand and appreciate the challenges which is being posed by antimicrobial resistance, and all of us together we can become healthy and live healthy in a healthy environment. Thank you so much.
A workshop was conducted at Wakiso District Headquarters, where district technical people were trained on antimicrobial resistance. Various representatives from sub-counties within Wakiso District were invited for the workshop.